Puppy.
Okay, this is definitely not my puppy, but I am Johnson. I am a person in long-term recovery. What that means for me is it's been over 11 years since my mental health or substance use challenges have prevented me from leading a full, rewarding, and productive life. I am honored to be here today to introduce you all to this amazing panel of some of the best brains in the business. These women are amazing. I get the opportunity to work for one of them and with all of them on different initiatives that are so important to so many people around the state. And we are grateful to the Georgia Council on Substance Abuse and the ARAD Committee for inviting us here today to have this panel on dual recovery and find out where we are, where we're going, and what we have to look forward to. And to get us started, each of our panelists are going to introduce themselves. Then we're going to have a series of questions that they're going to respond to for us. And then at the end, we're going to have time for some live questions. In the meantime, if you have questions for the panelists, if you could please put them in the chat. We're going to try to get to them all at the end. And with that, we are going to turn it over to Ms. Laura Colbert.
Hi, folks. I hope I'm not called on first for the entire session, but here we go. I'm Laura Colbert. I'm with Georgians for a Healthy Future. We are a health policy and advocacy organization located right here in Georgia, and we work so that every Georgian has access to the quality, affordable health care they need to live healthy lives and to contribute to the health of their communities. And for us, of course, health includes mental health, you know, an absence of substances that is interrupting people's lives. So we really think very broadly about what health means and is for people across the state. We have been a partner with the Georgia Council on Substance Abuse for about a decade now. So we have, you know, really been focused on specifically youth substance use prevention and recovery for that time. And we are a newer partner, although several years in now, with our partners in the mental health community. So we have learned a lot in that time about both the mental health and substance use recovery and what those journeys look like. So thanks for having us.
Thanks, Laura. Ms. Tucker, would you like to go next?
Hi, I'm Sherry Jenkins Tucker. I'm a certified peer specialist. I'm the executive director of the Georgia Mental Health Consumer Network, and I too am a person in long-term recovery. What that means for me is I have been able to take care of my behavioral health concerns for over 20 years so I can suit up and show up for my life. I am so happy to be here today, very honored that the Georgia Council on Substance Abuse would invite the Georgia Mental Health Consumer Network into this most auspicious day, and I am grateful for the opportunity. The Georgia Mental Health Consumer Network is an organization that is 30 plus years old. We've been able to provide peer support to people in recovery from behavioral health concerns for all that time, and we're delighted here today to meet with all of you. Thank you.
Thank you, Sherry. Kim, you want to jump in?
Sure. Hi, my name is Kim Jones. I'm the executive director of NAMI-Georgia, National Alliance on Mental Illness, and we are a grassroots organization that has 20 affiliates across the state to help support, advocate, and educate people on mental illness. And I too want to thank the Georgia Council on Substance Abuse for this event and for the ARAD committee for all of your hard work. I know none of this happens easily, so thank you so much for everything everyone has put in today to make it happen.
All right, thank you, Kim. And last but definitely not least, Jewel.
Good afternoon, everyone. My name is Jewel Gooding. I am the Executive Director for Mental Health America of Georgia, and we are an education, outreach, and advocacy organization. We support the elimination of stigma associated with mental health, and we work to reduce the rates of suicide across the state. We are a part of a nationwide affiliate based out of Alexandria, Virginia, and we serve as the statewide affiliate here in Georgia to ensure that we advocate for effective and accessible behavioral health services, but also prevention and treatment and ongoing supports. Just a proud partner to support the recovery. Personally, I am a person with a mental illness, and I'm also a parent of a child with a mental illness. So advocating is a personal mission for myself. And to see those who are fighting just to be recognized as the individuals that they are, I am happy to support this event and every other event that supports people in long-term recovery. Thanks.
All right, thank you, Jewel. And we are now going to start with our questions. And the first one, hi, okay, so we are going to start with our first question. And before I ask the first question, just want to make sure we all have the same sort of understanding of what dual recovery is. Dual recovery is a person in or seeking long-term recovery from substance use and or mental health concerns, okay? So that's our standard working definition for today. And we are going to, Laura, we will start with you this time, okay? Just so the spotlight knows the order. And the question is, what is working well for dual recovery in Georgia?
I have two answers to this question, and I am curious to hear what my fellow panelists say as well. I think two of the things that are working well for dual recovery in Georgia are peers. Georgia has, the first in the nation kind of peer program. And for that reason, the state has had a long history of really leading in peer programming. So you all, who I should probably be sitting and listening to instead of me talking to you, you all are one of the things that's going really well in Georgia in dual recovery. You really have created systems and programs that help to support people who are seeking or already in dual recovery. And I also think the other thing that's going well in Georgia is that the advocates here in Georgia, so most of us here on this panel, those who are primarily in the mental health space and those who are primarily in the substance use space are regularly together collaborating and working for shared policy goals, shared advocacy goals, and to reduce the stigma of both. So I think we have, that's not necessarily the case in every state, and in Georgia, I think we have a really special partnership between, kind of both sides of that dual recovery advocacy world. And so I think those are just the first two things that are going well, and I'll pass it off to my fellow panelists to say what else is going well.
All right, thanks, Laura. I don't think most people realize until you start going to other states and conferences and hear about the infighting and sort of tussles that happen in other states, how really fortunate we are here. So with that, Ms. Tucker, would you like to tell us what you think is working well for dual recovery in Georgia?
Absolutely, it'd be my pleasure to. Of course, the first thing that I want to step off with is what both you and Laura were just talking about, is the relationship that we have going on here in Georgia, particularly between the Georgia Mental Health Consumer Network and the Georgia Council on Substance Abuse. We have a long history of working collaboratively and cooperatively, and it's something that is very special and precious in Georgia that we don't see so much across the country. When I'm out there, well, back pre-pandemic, when I was out there on the road traveling the nation, I would so often hear about how surprising it was that we work together hand in hand, and we continue to do so, and that's a great gift here. One of the things that we have going on here in the dual recovery arena are double trouble in recovery meetings, commonly called DTR. We currently have 21 meetings that are going on online during the pandemic. We have 3 a day, 7 days a week. When we are not socially distanced and can be together, we facilitate over 60 double trouble and recovery meetings. And these are meetings where people can come and receive support for their mental health and substance use concerns. And so it's something, again, another really wonderful thing that we have the opportunity to do here, and it's funded by the Georgia Department of Behavioral Health and Developmental Disabilities, which has been a wonderful opportunity for us and people statewide. Additionally, we have peer support wellness and respite centers. The Georgia Mental Health Consumer Network has 4 peer support wellness and respite centers statewide. We're hoping to have a 5th one open in Augusta soon. And these are places where people in dual recovery can come and receive support. So I think all of those things are something that is beneficial to the dual recovery community in Georgia.
All right, thank you, Sherry. Next up, we have Kim Jones. Kim?
Thank you, Chris. And it's when you're further down the line, there's so much that is already been said, but to add to that, I would just say there's an increased focus on simultaneously screening for both mental health conditions and substance abuse in most healthcare centers, not just in behavioral health. And I think that is starting to work well for Georgia. You know, that wasn't how it always has been in the past. You know, usually your doctor didn't ask you about that, but I think the focus on the dual recovery and having doctors in the integrated health is starting to work better for us in Georgia. It's far from perfect, and there's a lot of work that we need to do. I also just loved what the ladies before me said, and I just have to repeat it because it is so exciting, specifically about our peers in this state. It's an honor to be from a state that has such a great program that focuses on peers and CPS programs that allows our peers to work and use their recovery as a positive tool. And then also us working together. I think that is something that we really have working well in Georgia. All of us who are connected to recovery, working better together and really being that one solid voice with our legislators.
Thanks so much, Kim. And Jewel?
Yeah, so Laura and I are going to have to switch, but lots of great things that have already been said, and to really just highlight just how much is not being seen here in Georgia, that Georgia is truly leading the world in peer support. They are one of the first states that had it as a Medicaid billable service, which, you know, is unheard of, unfortunately. There are states that are just now really pulling along with this. So since everybody kind of talked a lot of, you know, what is already existing, I will be, you know, not remiss to say that there are also evidence-based models here in Georgia as well, that has been significant in supporting dual recovery as well. So assertive community treatment teams is one model that is offered through contract providers through the Department of Behavioral Health and Developmental Disabilities. And with that essence, this is again for those who have more of severe and persistent mental illness, but it is an opportunity where you get to have your whole health actually really supported through all of the different providers that are coming to you in the community. This gives you an opportunity where you're not having to be hospitalized, but really receiving all of the services supports right in your home. And even though this isn't, you know, a widely open model, it is those who are struggling the most in regards to their recovery. It is something that is notable. There are other models like community support teams that are also offered. There are different programs throughout the state that works to really support those who are working with mental health challenges as well as substance abuse challenges as well too. So those are the other pieces that, you know, when you are really looking for treatment services and being able to get connected through those programs, I think is also notable. But what we really know, what makes all of this work is really the integration of peer support and really connecting with others so that you don't have to deal with all of the clinical jargon all of the time, and really pushing pushing forward a full recovery model for both mental health and substance abuse is something that has been highlighted throughout the state as well too. There has been different training efforts in order to increase that information, that education, particularly in our rural communities who do not have as many access to behavioral health providers. So that is what I would like to add, and just to say kudos and for all of those who've already spoken before me.
All right, thank you all. We do have a lot of great stuff going on here. But Jewel, since you asked for it, I'm going to let you take it. And we're going to take a little bit of a turn, a little less celebratory, and talk about what could be better for people in or seeking dual recovery in Georgia. If you want to go ahead and take that.
Well, I'm ready for that one. Let's talk about advocacy, right? We need more, right? And so we need better support for peers in the community. But I do want to at least start with how our treatment focus is kind of set up in the state. And yes, the department does well in providing those evidence-based models, but not as great for prevention and early intervention. That's where we really need that strengthening force. So as individuals are interfacing with providers, some of the challenges that we find is that it's either you can deal with your mental health first, or you can deal with your substance use first. And the idea is that, you know, you have to deal with them kind of together, right? Because they're both of the challenge. You don't know which one start. You know, the chicken or the egg is really what we kind of have to deal with. And so it shouldn't be when you're trying to seek services that you have to pick. There should be more accessible behavioral health services so that you can get all of your needs met in one fell swoop. It is natural that we want to have, you know, different providers, but to have to go to one provider for this and another provider for that, it becomes overwhelming. You know, recovery in itself is really about getting grounded. And when you're kind of pulled in so many different directions, or you're denied services that would be beneficial in either recovery phase, that's where you really start seeing more of those who may feel like they're not supported where they need it to really achieve that recovery motion. And it's like, do you treat one first, but is it really treated if you also have to get something else treated? So it's really, that's one of the, I think the major barriers here in the state. And even though it's not unique to Georgia, it is one that, you know, we're Georgia advocates, so we advocate very strongly for. We look at opportunities so that people can get their support wherever they are for, whether it's for mental health or for substance abuse, that you don't have to be pulled in two different directions. So looking at better training for providers, really understanding that recovery model. Some of our challenges is that a lot of our providers are still very medical focused. So that meant there's less partnership, and more of that, just do what I tell you to do because I'm the expert. And well, what we know is that you may have gone to school a lot longer. It doesn't necessarily mean you're the expert on me and my recovery, right? So it's really getting that partnership, understanding that this is my recovery journey, and that I am coming to you to help get me through that recovery journey, but it's a partnership, and it should not just be you telling me everything that we need to do. So really helping and supporting better training as we have more clinicians coming out, having that dual training where you're able to support both of those needs. And not to say that it has to be everywhere, but there should never be a point where you're told you can't get support for this, for mental health because you have to work on substance use first. It should be, let's figure out a group plan so that you can achieve recovery dually with the things that you deal with on a day-to-day. So with that, I'll pause and so my other panelists can speak.
Thanks, Jewel. I know that my primary diagnosis is definitely being Chris Johnson. Everything else comes secondary. And if you can figure out which little piece of which needs to be tended to first, well, you're doing better than I am. But Kim, let's see what you think could be better for people seeking dual recovery in Georgia.
Yeah, Thanks, Chris. And again, agree wholeheartedly with Jewel. I think the recognition and the awareness of dual diagnosis is really important, and just the education around that, as Jewel said. And there's just a shortage of the dual diagnosis residential programs, and the complexity of dual diagnosis often requires longer term intense treatment or support from peers and from others that we currently see offered in our state. So we really need to work on opening up funding across the state to fund those, and to make this a friendly state to programs that want to come to Georgia to be address dual diagnosis. So I think just opening up, as Jewel said, the training to our physicians and our doctors and our healthcare workers that we currently have, to make sure that they're familiar with it, they're aware of it, they are trained in how to refer people to peers and to other people who can support them when they're not in a provider situation, is probably the most that we can do right now. And also getting more peers engaged and being able to be supported through funding to do the work, I think is really something that we need to do to help dual recovery right now.
Thanks so much, Kim. Ms. Tucker, would you like to go?
Absolutely. I certainly concur with Jewel and Kim with regard to our state needing to have the focus and the ability to work with people in dual recovery and with from a dual perspective. As you said so appropriately, Chris, you know, the diagnosis that you're clear about is that you're diagnosed as Chris Johnson. And that's the case with all of us. You know, we come into this as whole people, and if we have to be, you know, sort of taken apart to receive services, it disrupts an already disrupted life. So having the ability to access promising practices in the dual recovery arena makes so much sense to me, and it's something that Georgia has taken risks on all of these years with certified peer specialist training and so on. So we have a great interest and desire to work more in the dual arena, and it would be wonderful to see the silos with regard to recovery services go away, so things don't have to be parsed out, mental health versus substance use and so on. So that would be so helpful with regard to DBHDD, DCH, and so on, to be able to support people with what they need as whole people. And I think that the state could lead the not just services in the state, but could once again lead the country in these efforts, and we would very much like to step up and help them sort it out. One of the other things that we think would be really helpful with regard to working with people in dual recovery is to have a system that is trauma informed. So many of us have histories of trauma that were even re-triggered by the care and treatment we receive in the system even. And so have a system that is trauma informed will go a long way to meeting people where they are and supporting them on their recovery journeys.
Yeah, thank you, Sherry. And you know, that trauma piece, when we look at the numbers of people who are incarcerated with mental health and or substance use challenges who also have significant trauma in their past, the numbers are huge. And, you know, I think that's a sideways way of, you know, reducing incarceration, which I hope is the goal for all of us. Now, Laura, are you ready for us?
I'm ready this time. Yeah, I co-sign everything that was said by the previous panelists, and Sherry especially. I think she's touched on something really important, which is kind of that whole people piece, right? So while I think there are some really promising things happening in the dual recovery space, often even if the dualness of substance use and mental health is recognized, sometimes that's not also attached to the rest of our bodies that exist, right? So like the mental health and substance use exist in an entire physical body that may also have other needs. So, you know, something that we would like to really see some improvement on in Georgia is having mental health and substance use integrated into other kinds of health settings. So when you get your primary care appointment, are you being asked about mental health or substance use each year? And vice versa. So like when you go to see, you know, a mental health or substance use provider, ideally both together, right? Maybe you can also like have your diabetes check at the same time so that you are taking care of an entire being all together in an integrated setting, and with a care team that understands that one of these will impact the other and vice versa, right? So if you're not, if your mental health is not being managed, then like maybe you also can't manage diabetes in that moment. And so getting both of those, you know, managed together is an approach that might be needed. So that is certainly one thing that we think still needs some improvement. And that's not unique to Georgia. That is across the United States health system. So we are not alone in that. And there are some promising practices out there that would help with that. The other thing I would mention that needs some improvement in Georgia is kind of even before people get into care. So often, you know, one of the things that is blocking people from getting to care is whether they can afford it. And in the US, the way that we typically afford health care is through health insurance. And Georgia just has a really difficult health insurance and access to care systems. So it's hard for people to just get in the door to affordable care because health insurance is hard to get here. So our state could make it a lot easier for low-income Georgians to get health care with a Medicaid expansion, and that would help to cover some of these mental health and substance use needs. We know that a quarter of those low-income Georgians who would be covered by extending the Medicaid program to them have mental health or substance use conditions that are going untreated right now because our state is one of 12 that has chosen not to provide health coverage to low-income folks. So there's some really easy choices that our state could make to just get folks in the door to affordable care earlier and easier.
Thank you so much, Laura. You always have such good words. I always have such harsh words, so thank you for saying those things the right way. It's amazing. And as a side note, for those of you who may not have noticed in all of the avalanche of news that we seem to get every day, the Affordable Care Act enrollment period is either reopening soon or has reopened now, and that is going to be, there's an enrollment window for folks who didn't have the opportunity to enroll last year. So that is an opportunity that we have now that we didn't have recently. So our next question, and Sherry, we will let you start because this is Addiction Recovery Awareness Day at the Capitol. We are talking about some legislative things today. And our next question is, beyond what could be better, like what legislation, policies, or practices could be adopted or changed to better support people in or seeking dual recovery?
Well, dreaming the big dreams for the future, we certainly would like to see a peer recovery and wellness center in every county in the state of Georgia so that people could receive what they want and need to recover and maintain their wellness, particularly people who present with dual recovery concerns and want to access whole health supports. And so that's a big dream that we would have as we go down the pike. We also would like to see the recognition that it is a fact that substance use disorder, and I'm sorry to use that kind of language, but it is the language out there in the system, is a mental health diagnosis. And so if we could get recognition from all communities that we're all welcome with regard to each other's services and supports. I think that would take us a long way to being able to have the conversations that we would need to be able to get legislation and policies that would work for all of us. I would like to, the big dream that I have is that any one of us that would walk into any room with regard to supports would be welcome. And I believe that us being invited here to ARAD by the Georgia Council on Substance Abuse is a great example of what I want to see us continue to do, which is to welcome each other for this most important work. So we can really achieve recovery and wellness for all.
Yeah, thank you, Sherry. I know outside issues are not a part of the recovery movement, right? We all issues are welcome here, and that's a fantastic thing. Kim, would you like to jump in next? And
Sure.
do you need me to repeat the question, or do you have it there?
I have it.
Awesome.
So legislative policies that I would like to see adopted for dual recovery. I mean, when I think of the state, we're ranked for 51st in access. So there's so much to do. There's nowhere to go but up, you would think. And I really worry about that sometimes with our state. But unfortunately, we just had $91 million cut from the budget last year. So, first, let's replace that would be helpful. But I'd love for us to be focused on more of a prevention model. And just in general, increase the funding. I mean, we were 50th before we had the $91 million cut. And I don't even know that they included that when we dropped down to 51. So really just looking at the amount of money that Georgia puts towards mental health. I also would love to see hospitals required to treat people with mental health and held accountable for treating people within their communities. And I mean just general emergency room, that if you are struggling and you want to go somewhere, that people don't, we kind of have a system right now where you have to be diagnosed before you know where to go. And just opening that up so that people have the awareness. So a prevention model, I think, is really, really important for dual recovery and educating people, increasing funding for dual diagnosis specific treatment, both outpatient and residential, and increasing the funding and reinstate the funding that was there for peers across our state, and then increase it. There's just the parity of just understanding that mental health, dual diagnosis, all of this is a part of, as what everybody has said, as our health, and needs to be treated in the same respect. So those are kind of the policies that I hope will be put in place by our legislators.
Yeah, thanks for that, Kim. The prevention piece to me also goes hand in hand with the maintenance. It's like, we don't, with our cars, we don't maintain our tires or our oil, right? We have to maintain both to keep it going. And with me, my recovery is the same way. I have to maintain both to keep this car moving. Jewel, would you like to jump in?
Sure, absolutely. So, and there are, naturally a plethora of different legislative asks that we have, but I do have to kind of circle back to the one thing that Kim has mentioned is the funding. That's really our major piece of it. So one of the things that I do think about, probably one of my lofty goals, is that integrated healthcare. So a lot of what Laura has kind of already talked about, and not even just dual recovery, but again, taking that whole health perspective, that we can get supports in that one area, of our entire lives. We have one brain, so we should be able to get that support to be able to support our brain health overall. Naturally, outside of the funding and, very simply what Kim had discussed earlier is really just kind of looking at how we can really maximize our resources that we do have. We do need a greater workforce. Workforce shortages are across the nation an issue, but it is certainly a huge issue right here in Georgia. So incentivizing individuals to be able to offer better services. We need more providers who are willing to accept Medicaid insurance as well. Other things that we can kind of look at is making sure that it is funded. So looking at parity as well, and making sure that with our commercial insurance, that we do have equitable access to our physical health as we would our mental health as well too. So really honing in on how we really talk about our behavioral health overall, and really reducing that stigma. And I know that's not necessarily a policy change, but it is one of the major factors for people being able to access care. So having those prevention dollars, training is really important, not just for individuals in our state, but our providers, our stakeholders, really being educated on that, because it also means recognition is important. Recognizing when support is needed for both of those is another big piece that we have to push. So legislatively, we also have to do our part. And making sure that we are supporting individuals, but making sure those services are in the community as we need them. So it doesn't just rely on the State Department. It's not just the Department of Behavioral Health and Developmental Disabilities. In essence, they serve a very small population of individuals who are completely uninsured or who has just straight Medicaid. Majority of your insurance, your services are coming from your insurance providers, and that's the Department of Community Health if you have Medicaid or Medicare, or your commercial insurance. So if you have Blue Cross Blue Shield, if you have United Healthcare, really recognizing that there are available resources through our commercial providers that we can ensure that we can access behavioral health as well too. So want to make sure that we are not leaving those important groups out of that legislative pool, so that there's better management. The contracts that are approved here in Georgia, that management, there are just so many network adequacy bills that you may see if you are tracking legislation, really understanding how that impacts you. If you get those surprise billing, all of that really is so important when we think about, our overall health, is because that sometimes will lend to some of the challenges we deal with for our mental health. So I do think all of that is also something that we have to take into perspective as well. And even though it doesn't seem to directly support dual recovery, there are so many other challenges that the state are faced with that could still support being able to engage more individuals. So that expansion of peer support, that expansion of community organizations that supports resiliency, that supports recovery. And really, and I know we haven't really touched more on this, but supporting children in their communities as well too, as a more of a prevention aspect of it. So making sure that we are starting a lot earlier in educating our youth, and making sure that there are funding dollars that support those too. I think Chris had alluded a little bit about the criminalization of mental illness and how oftentimes people receive services in our correctional systems. So how are we doing more in diversion and ensuring that people get connected to providers rather than jails and prisons? So that's other aspects that I just wanted to highlight as well.
Thanks so much, Jewel. And you also, that whole access question in Georgia, especially for our rural neighbors, there are whole counties in Georgia where there are no services, none. There might be a licensed clinical social worker in the high school or who serves the whole rural school system. But in terms of how do you get access when there's no services, right? And I think our rural neighbors deserve the same access we have. And it'll be improved for sure, but no one should have to. Go ahead.
Yeah, the access to, just to kind of speak on that, we don't even just refer to behavioral health access. We're talking about an access to a pediatrician. We're talking about access to a dentist. So even our health providers, it's not just behavioral health that there's a shortage. There is just a shortage of all health providers, particularly in our rural communities. They have to travel over 50 to 100 miles to get to any type of provider. You have so many different counties who don't have labor and delivery. They don't have hospitals. They don't have pharmacies. So, I mean, there are just a plethora that when we talk about workforce shortages, there is actually a website, and you know, depending on if you want to get into advocacy and legislation, but they are tracking what some of the challenges are and not having access to those different providers. And we don't talk about how important dental care is to our behavioral health. And when we slip off on our dental care, we start getting a lot of other health conditions overall. So that's why it is so important that when we talk about workforce shortages, we are really looking at the gamut. Now, naturally, yes, we need more psychiatrists, we need more psychologists. Social workers are again, overly utilized. You may have a social worker to almost 10,000 kids, and you cannot confidently support over 10,000 students with just one social worker. So that's the other piece, and opening up different Medicaid billing codes and ensuring that providers who may not be a behavioral health provider can still bill for some of those services. Otherwise, they're not able to do those screenings and aren't able to do those early interventions. So I'm so sorry. Let's move on. I'll get off on a tangent.
No, thank you, Jewel. All good information to have. And it seems like some information that Laura might want to piggyback on. Laura?
Yes, I was literally like trying not to jump out of my chair, so excited by everything Jewel was saying. I was talking with somebody this fall who does advocacy in the criminal justice system, and she said something to me that has really stuck with me for months now. She said the failures of our healthcare system wash out in the criminal justice system, and I think no one is more familiar with that than people who are familiar with mental health and substance use concerns and recovery. That I think that there's nowhere that that's truer, right? So we want to make sure our healthcare system doesn't fail so that folks don't needlessly fall into the correction system and the criminal justice system. As Jewel said, I think there are a number of pieces of legislation we'd really like to see around how health insurance can better cover mental health and substance use. Often we put that under that umbrella term called behavioral health parity, and that just means that we want health insurance providers, whether they're Medicaid, Medicare, or private coverage, to treat mental health and substance use just as they would any other kind of service. So whether it's cardiac care or COVID care or anything else, we want mental health and substance use to be treated equally. There is a federal law for that already, but it turns out that Georgia has not done a great job of enforcing and implementing it. So a state law would really go a long way in helping kind of move our state agencies to really holding our insurers accountable. So that's one thing we'd love to see. Jumping way back to Kim, the prevention framework and prevention approach is absolutely necessary. We know that healthcare, whether it's mental health and substance use or any other kind of healthcare issue, is a lot easier to deal with on the front end if you could prevent it than it is on the back end when you're kind of dealing with the full scale of the issue. So putting in place prevention and early intervention services in places where youth are, particularly schools, but also in other community-based settings where young people are at. Putting those services and screening opportunities and embedding those into schools and community-based settings is critical. And some of the funding that the state needs to invest in dual recovery should go towards programs like that and systems like that. statewide. So ideally, every high school, every middle school in the state, every student every year has some kind of, trauma-informed dual screening, so that problems can be identified early, and that there's supports, embedded in those same places, so that it can be dealt with in the community and in the school, rather than, having somebody get suspended months down the line and, having to find an expensive provider 3 counties over. It would be a lot easier to do if it's kind of integrated into the community. And on the behavioral health workforce front, psychiatrists, it turns out, are really expensive, and it takes a long time to make more psychiatrists, right? You got to go to school forever and I don't know, take a bunch of tests. I don't know, I'm not a psychiatrist. But one thing that would help kind of help support the behavioral health workforce is to grow the peer support programs, and also grow other kinds of non-physician provider opportunities in the healthcare system. So that usually means, nurses that have mental health or substance use training, or social workers, or licensed professional counselors, and having ways that the healthcare system can sustainably pay those folks to be a part of the system. Our healthcare system just currently doesn't work that way. The state and the federal government will need to work together to kind of solve those issues in a way that makes sense. But I think there's a lot of opportunity there, and our state could certainly, look at some legislative opportunities to kind of promote those non-physician roles in the behavioral health system, and to make sure that they're able to sustainably stay a part of the health system in the long term. And then Medicaid expansion, because I can't be on a panel without saying Medicaid expansion. So I'll leave it there.
Thank you, Laura. And, you actually jumped ahead a little bit into our final question. I mean, that's okay, but, that whole staying hopeful and looking forward thing is something that, we're really good at. Even in Georgia, even with our budget cuts, we stay hopeful. It's what we do. But we all know that we can't achieve a goal, we can't realize a vision if we don't have a vision. And that is why our last question is for each of our panelists. And we're going to start with Kim, because Kim, saved the best for first for last, right? And by the way, folks, we had any questions in the chat that I've seen, and we're going to have a few minutes for questions. So if you have a question for any of our panelists, hopefully you don't have any for me, please put them in the chat. And we're going to kick off with Kim. Kim, what is your vision for dual recovery in Georgia in 5 years?
Well, I'm all good with that until you say 5 years. And I don't think this could happen in 5 years, but I think it's what I envision, not only for dual recovery, but for health in general, is that we are a state where all of our health needs are met through our current system. It's integrated. I can go to the emergency room, I can go to a hospital, I can go to a doctor, and all of my health is looked at in one place, and I don't have to diagnose myself to figure out where I need to go. And so, when we look at how do they handle diabetes, it's a chemical imbalance in the pancreas. Mental health is looked at as a chemical balance in the brain. Alcohol can be looked at as a chemical intake into your body. When you go and you have a diagnosis of diabetes, you get a nutritionist, you get a wellness, they give you a discount to the workout. I mean, what if we had that for dual diagnosis for mental health? Why isn't it like that? When we think about how our state looks at, first aid, I would love to see mental health first aid or some training in all the different companies that we have, where it's treated as just, there's parity there. It's not a judgment. There's an awareness and acceptance that people don't look at it any differently. When I do talks and I ask people how many people are trained in CPR, I've been trained 1 million times. And then I ask how many people are trained in mental health awareness or something like that. Very few hands go up. But then I ask how many people have experienced somebody who is in a situation where they need help, either in their mental health crisis or substance abuse crisis, and several hands go up. So the thought process that we aren't training in that area just is something that I have a vision that we will get there. So I'd love the opportunity that if you are in crisis, they call an ambulance. How about that? That would be a great start. Don't call the police, call an ambulance. So universal healthcare screenings for co-occurring disorders, wider acceptance and knowledge of that substance abuse and mental illness are intertwined and must be confronted together as a disease, and that the funding is more available for dual diagnosis specific treatment. That in 5 years, but I'd love to see that bigger picture.
All right, thank you, Kim. Laura, do you want to jump in?
Yeah, I mean, I think I think the full panel has said beautiful things today about their visions for the future. I think what I hope most is that both our policymakers and our health system and any other kind of influences on kind of how we get access to care, that we can help shift them from a scarcity mindset to an abundance mindset, right? So that we don't have to choose between education funding and healthcare funding. There's a way to do both of those things, and that both can benefit at the same time. That we don't have to choose between substance use treatment and mental health treatment, and that those should be treated together and in partnership. So I guess I hope that in 5 years we've made significant progress on kind of helping the decision makers that influence our access to care, that we have helped them understand what we need in that way, that it's not a scarcity landscape that we live in, that these things work together and are that they must be addressed together, and that we will all benefit more from it that way.
Thanks, Laura. Jewel, would you like to share your vision with us?
Absolutely. So just when we think about 5 years, and I have to concur with Kim, is that not a whole lot can get done in 5 years, particularly when it comes to revamping a system. One of the things I do just want to preface is that this does require systemic transformation. Like, you literally have to, it's kind of like you get a house, right? We're flipping houses over here. So you got to do a complete demo. Just bulldoze that entire system down and just start building it up. And let's start with a good foundation with the cement. One of that is that education and that cross training across health providers, right? But that is literally where you think about what my big dreams are. Yes, we have to, flip that house, but let's just go ahead and gut the thing completely out. But shorter term, I think, is more doable. Things that I do want you all to be aware of is like the 988 number. That is going to be an opportunity for people to access care. And when you call 911, right, you typically, if it's a medical emergency, kind of like Kim was talking about, you get an ambulance. Not so much if it's a mental health challenge or even substance use involvement. You are going to get law enforcement. And this, hopefully with the 988 number, you will still have professionally trained individuals who can respond, very similar to like the Georgia Crisis and Access Line, which is our mobile crisis. So taking mobile crisis and actually making it a statewide. Right now, even though it supports the entire state, it kind of doesn't have enough of the capacity to support the entire state, because that golden thing we call money is necessary to really support all of the Georgians who are in need of immediate crisis support. So looking at that piece of it, another thing that I think is more closer to our reach than we really don't give credit for is dual response models. So when you do have to contact law enforcement, that we do have a coupling of a behavioral health crisis person, and that could look like a certified peer specialist, being able to respond and to connect with individuals when they're in crisis, because you're going to more likely get those to not feel so escalated in the situation because someone is responding to you with the skill set is necessary to really support you in your environment. So having either those dual respond models or making sure that public safety officers and all those who are involved have the right training to support individuals who may be experiencing crisis. So really, I think crisis is going to be my number one, is that's usually, unfortunately, with stigma still being a challenge, is that you don't need help until you need help. And we want to make sure that when you need help, you get the right response so that you are connected to services and that, again, you're not getting connected through jails and prisons. It's where you usually will end up. So I think that's a little tangible reach, overall. But I also want to see an expansion of, right now it's a billable service here in Georgia, but we need to make peer support a common practice in all and across all settings. So that means including emergency rooms, but also your practitioners, your family practitioners. Every time you are interacting with any type of health provider, there should be a certified peer specialist, and whether that is for a certified peer specialist, addictive diseases, mental health, if it's for children, you have for parents, you have for youth, making sure that those models are actually expounded upon outside of just the general Medicaid system, but for all Georgians so that they can have that support. Support is needed at whatever level that you may be at. So it's not fair that we aren't able to see this every place that we go and making it a common practice to reduce that gap in workforce shortages. So I think, and the other piece that is a lot more tangible is what we're doing with our school systems and making sure that we are providing therapy and other services where you can meet them at. That's a little bit more tangible with the Georgia Apex project, that we expand upon that so that it is in all schools across the state, so that more students can access to services a lot quicker and be able to shift into that recovery mode. So I'll stop talking. Thanks.
Thanks, Jewel. Sherry, we have just a couple of minutes left, and I want to be able to answer George's question because I love George's question. But if you want to share with us your vision, we would love to hear it.
I can be really quick.
But go ahead.
I can be really quick. I have the vision of no wrong door. No matter whether you present with a mental health concern, substance use, addictive disease concern, a general medical concern, or all the above, there's no wrong door. So wherever you present, you can access the care and treatment you desire for your recovery and wellness. I must repeat Medicaid expansion, Medicaid expansion, Medicaid expansion. I would like to see universal health care, and I think that it would be beneficial to everyone across the board. Our country would be greatly benefited, and I will reflect what others have said. Certified peer specialists need to be available everywhere for all. The only wrong place for CPS is no place. Thank you.
Awesome. Thank you, Sherry. And while no one asked me, I'm just going to jump in here. My vision 5 years from now, I want everyone in recovery in Georgia, whether they're in mental health recovery or substance use recovery or both, to accept and to honor all pathways to recovery, because that is not something that's real here yet. And we need that for everyone to stay well. Everyone's road to recovery needs to be real for them and honored for them. And this question, and I am going to jump back up here, is what's your most recent and best example or story of successful or progressive dual recovery? George, I had a sponsee, a 12-step sponsee in Statesboro, Georgia, who just couldn't get it. He couldn't get it. He didn't want it enough, right? Nothing worked until I went through CPS training and let him find his own pathway to recovery. And 6 years later, he announced on Facebook yesterday that he is engaged and will be adopting the child of the woman that he is marrying. And he is in long-term dual active recovery today. And that is my story. We are up on 2 o'clock here. I want to thank all of our panelists, Jewel, Kim, Sherry, Laura, thank you all so much. This has been a fantastic hour. Hopefully all of you are inspired to make change in your communities, because we're certified peer specialists, we're peers in recovery, and change is what we do best. And we are out of here. Thank you all.
Thank you. Bye.
Bye.
Thanks, everyone.